that we assume their severity and their symptoms are less. When we look at older children, high school age children, their physiology is very similar to that of adults, of the teachers and staff that are going to be in the schools with them. So we have to treat them as such in the sense of how likely they are to contract and transmit the disease. We know that almost anybody can be a carrier. In fact, last week, JAMA put out a study that showed that at least 50% of people who are transmitting the disease to others are doing it without knowledge of having the disease themselves, meaning they're either an asymptomatic carrier or they're pre-symptomatic and they're yet to develop symptoms. This will happen in schools. It will happen between staff. It will happen between teachers, and it will happen between students within the schools as well as taking it home to their families. This is an unnecessary risk. On top of that, JAMA back in July of 2020 published a study that showed the impact of school closures in the spring was extremely positive in reducing mortality, as well as reducing the amount of cases of COVID-19 in our communities. Back in the spring, when this disease was not nearly as rampant as it is today, that article discovered that by closing down schools, we reduced the amount of community cases by 62% and the amount of mortality by 58%. If we plug our children all back into school, mandate them to go back in a setting in which transmission is even more rampant, we're going to see disastrous consequences. Additionally, when we look at vaccine distribution, we're so close to getting to a point where we can eventually consider going back to school with safety precautions in place, meaning proper ventilation, still wearing masks until we drive down that positivity rate in our communities. But we can't do this prematurely. The vaccine is here. It's just a matter of getting enough and distributing it effectively. I myself have not gotten my second dose, and we're in such a rush to get people back to normal life that we're not paying attention to how we can distribute this safely. And teachers are a priority. They are somebody that we need to get. Staff is a priority. They are people who need to get vaccinated, but it's not going to happen overnight. And even with the vaccine, we have to take time to allow it to become effective. After the first dose, 2 to 4 weeks after the first dose, you can have up to 54% protection with the current vaccines that we have right now. It takes really the second doses to get us to that full protection of 94 to 95%. But even after that second dose, it's an additional 2 weeks, meaning from day one of vaccination up until you get that full protection, it can take up to 6 weeks. So we can't just rush people back to school with the anticipation that we might get a vaccine and that that vaccine could be effective. We know it's going to be effective if we give it enough time to act and enough people to get it. Ultimately, this is also an issue of health equity. We've seen over and over again that it's unfortunately the brown and Black communities that are being the hardest hit with COVID-19. It's the low-income communities that are being the hardest hit with COVID-19. By forcing everybody to go back to school, we're only going to drive that rate of disparity through the roof, because it's those populations that have reduced access to care, reduced access to getting tested, reduced ability to take the day off from work because they're not feeling well and seeking care and delaying care. And thus, we're going to see that community and those communities that are already marginalized having more disastrous impacts from COVID-19. Even looking at our vaccine distribution within the state, we're seeing those inequities exacerbated because a lot of the signups are online only. And several communities in these marginalized populations don't have access to those online signups, or they're in clinics that only provide it to established patients. So we're already seeing the impacts of having a system that's not ready for the distribution needs we have. And it's not ready to handle inequities that are already being exacerbated in the midst of COVID-19. We have a community where we have spread out of control, and we have too many vulnerable lives on the line, from our students to the parents, to the household members, to the teachers, to the staff, to the bus drivers. And it's really should be at the local level where we can understand the resources at our fingertips, the resources such as proper ventilation, such as spacing, such as masking needs that are going to enable these decisions to be made safely. A statewide mandate is not the way to go, and it could be one of the most dangerous things we do during this pandemic. Thank you.
Hi, everybody. We're having some technical issues with getting this video to stream to Facebook Live, so we're going to post it later online just to let folks know. But it's really important for us to listen to community stakeholders, experts in this time, because there's a lot of factors at play. And so, Dr. Perencevich, could you talk a little bit from your perspective about the issue? I know you've already spoken to the Senate in the subcommittee hearings. And I'm going to unmute you. Let's see.
Thank you, Senators and Senator Trone-Garriott. I'm Eli Perencevich. I'm an infectious disease physician and epidemiologist here in Iowa City. Probably more importantly, I'm a parent of 2 kids in the public school system here, and the son of a retired English teacher who got her start in the Des Moines North High School. So I've kind of looked at it from the perspective, and Dr. Srinivas really hit everything. She's pitching a no-hitter, and so I'm a closer. I don't want to blow it here. She really hit all the points. But I'm looking at a perspective, all the focus has been on children, rightfully. We want our kids to get back to school 100%, but we have to do that safely. And almost all the messaging around this nationally, and Dr. Srinivas mentioned this, is around kids not getting infected or kids not seriously being infected. But unfortunately, we know that kids of all ages, particularly probably over the age of 6, get equally infected to adults. It's just subclinical. And so they can silently spread the infection. They're just as infectious as anyone else. Anyone 5 years ago, if we went and said kids couldn't get infected and could spread a respiratory virus, you would have probably laughed very heartedly. So we know they bring the viruses home. And anyone who's had little kids know that they bring it home. And then they infect the parents. And one thing I want to point out just got published today in MMWR, the CDC's kind of main epidemic journal. They reported on 2 outbreaks related to wrestling tournaments in Florida. So high school wrestling tournaments. And the number that really hit me with that is that when they did the contact tracing, they had an attack rate in their household of 30%. So 30% of the parents and other kids in the house got coronavirus infections from the wrestlers who came home. So these kids are spreading it in the home. And unfortunately, 1 person died just from those 2 wrestling tournaments. So that's and these aren't the giant statewide ones like we had here in Coralville, the girls wrestling tournament. These are smaller wrestling tournaments. And so really that's my main concern is how do we protect the teachers? How do we protect the parents in the home? And so the other thing that was kind of against us today were all these headlines that it's safe to open schools. And you have to know that data is incredibly biased. We're not testing kids. And even when we are testing kids, almost all the schools they've looked at are in some sort of hybrid or reduced attendance model. And so there have been several studies that have shown you can open schools safely if you can maintain the 6-foot distancing, if you can mandate masking, and most importantly, get folks to wash their hands and definitely wear masks. So this kind of forcing it open without